It's not just about body weight. It's about an energy toxicity from chronic caloric excess. And that's more than just body weight. This leads into things like visceral fat, chronic inflammation, and a whole host of downstream health problems that come with it. Hey everybody, welcome to the first episode of Health Notes with Dr. Bob. I'm Dr. Bob Driver, board certified physician, and I'm the founder of Spartan Medical Associates, and I'll be your host. I have over 25 years experience in the medical field, either in the emergency department or in my own clinic taking care of my private patients. Joining me today on this episode, and most episodes, is our producer, Dave.
Good to be here. And just for everybody, not only am I the producer, but I'm also Bob's brother. So we go way back. And like everybody who has a doctor in the family, you'll note that they get a lot of questions from everybody. So you explain where this evolved from and where we're going.
So I first had the idea of shooting some videos that would be a resource for my patients. And then you had the idea of, hey, why don't we turn this into a podcast and maybe it could be a resource for everybody. And so this really came to where we are now. We're going to have a show where we answer patient questions or viewer questions. I have a lot of topics that I want to cover. These are things I cover with every patient of mine. But then again, if you have questions, viewers have questions along the way, you can come to healthnotes.net and leave your questions for us, and we'll have topics in the future.
I think to start for the first episode here is to start with you created a structured nutrition guide to help your patients. Why nutrition?
So when I work with any new patient, I have in my head, I have a framework that I work through with everybody, because this is, in my opinion, the order of magnitude, the things that are going to have the most impact in someone's overall health. Number 1 is exercise. Number 2 is nutrition. 3 is sleep. 4 is mental health and happiness. 5 is traditional medicine, pharmacology. 6th is kind of a wastebasket category of everything else. I get a lot of questions about things in category 6, but I really go through with all of my patients all of these things. And I think one of the truly foundational ones is nutrition. And over the years, I've had this conversation with so many patients that I really thought it would be helpful to get my ideas down so that they could have them all in one place. And I ended up writing it down. It turned out to be over 10,000 words and turned into a nice little book. We're actually going to make this nutrition guide available to anybody who's interested. They can come to SpartanMedicalAssociates.com and just download the book. You're welcome to it. It's free information. I hope it's helpful. I'll let you in on a little secret. Doctors don't hide information from their patients. There's nothing we don't want you to know. So we're giving away the nutrition guide.
So Bob, tell me what you mean by structured nutrition plan.
All right. So that's a term
Let me
I came up with. Yeah.
Wait, let me ask that a different way. What's the difference between a structured nutrition plan and a diet?
Okay. So a diet, or I think most people think of when they go on a diet, this is like a temporary change that they're going to do in order to have some kind of health outcome, body comp change, weight loss, whatever it is. It's usually a temporary measure. And a structured nutrition plan is really something that I want people to follow long term. And when I work with people in nutrition, one of these ideas that a lot of patients kind of already feel that I've got a good handle on my nutrition, right? Well, I eat clean, right? Well, I dig into that with them. What do you mean by that? That's actually a little too vague. The analogy I like to use is it's the difference between working out and training. Working out is going to the gym. You go in, you do a bunch of stuff, you get your heart rate up, you feel good, but you don't really make any progress. Don't get me wrong. Working out is better than being sedentary, but it's not training. And as we get older, especially, right, when you're young, your teens and your 20s, any bit of exercise you do seems to make you bigger, stronger, faster. But as we get older, you really need to have some structure to your exercise. It's the same way with nutrition. By adding a little bit of structure, right, where it's measured and it has a goal, By adding a little bit of structure, we're going to get a lot more health gains out of our efforts in nutrition. With that, the 3 pillars of my nutrition program, of the structured nutrition, are simple. Number 1 is optimize your daily protein intake. Number 2 is control your calories for the week. And number 3 is find ways to consistently do number 1 and number 2. That's it. If we just focus on these 3 things and these 3 things alone, you're going to have great health outcomes from your efforts in nutrition. Everything else you can let go.
Yeah, why is protein first?
So protein is first because protein is required as a building block, not just of our physical body, but of really every protein that we make in our whole biological system. We need the amino acids. They're only delivered really through our nutrition. And there's an optimal level that we want to get. That's not a level that happens by accident. You know, the RDA has their protein recommendation. That's really to avoid a protein deficiency. But we like to think that not having protein deficiency is not really a great target. That's kind of equivalent of saying, if you get a D in school, that's fine because a D is a passing grade, right? We really want people to aim a little bit higher than that. Also, having adequate protein or optimal protein intake is pretty satiating. It helps with, number 2, it helps control calories.
Right. So what's the difference? Because I fall into the trap of eating what I think are called energy dense foods, stuff that's very processed. You get a lot of energy in a way, but it doesn't sustain you throughout the day. Certain foods don't sustain you throughout the day.
Right. And so this is some of the things we cover in the nutrition guide. How to look at your foods and understand, is this a nutrient-dense food? Is this an energy-dense food? Where we want to aim for is food that is nutrient-dense while being lower in energy density, right? These are things like whole fruits and vegetables, lean proteins, right? The problem with processed foods isn't so much the processed part of it, it's that these foods are highly calorically dense, right? High energy density, low nutrient density, very low, low protein intake, but a ton of calories. They're also engineered to be hyper palatable, so you end up eating too much of them. The net of all of this is you end up with chronic caloric excess. And really, this is when we look at, well, why do we need to control total calories? It's not just about body weight. It's about an energy toxicity from chronic caloric excess. And that's more than just body weight. This leads into things like visceral fat, chronic inflammation, and a whole host of downstream health problems that come with it.
You have a specific target for protein. How do I target protein above everything?
Right. So when I talk with patients about trying to hit a protein goal, it's how much protein should they take in a day. I have them aim for 1 gram of protein per pound of ideal body weight or preferred body weight. Now that's actually probably a little bit more than they need, but directionally that's where I want them to go. 1 gram per pound. Why? It's easy to remember. They don't have to do any math. What's our true target? 0.6 to 0.8 grams per pound is where we want to be. But if we aim a little bit higher and we fall a little short, that's fine. We're still going to actually hit our protein target. And like I said, that amount of protein isn't going to happen by accident. You need to be intentional, and you need to learn to be intentional about your food choices. And if we start with, hey, I'm just going to aim at getting this protein target every day, that's a great place to start. We can then work on ways to lower total calorie intake or be consistent with controlling the total calories as well.
So what are the targets? What are we trying to do in terms of when we're looking at the numbers on the side of the container and we see calories, fat, carbohydrate? What's the balance we're trying to hit there?
So this is very individual. Protein, we have a specific protein target. Understanding what your calorie target is going to depend on a lot of other factors. And counting calories is probably not truly the way to do it. One simple rule for consistency that I like to teach patients is a 10-to-1 heuristic. For every 10 grams of protein, a simple 10-to-1 heuristic, for every gram of protein intake, you want to have less than 10 total calories. So let's break that down a little more easily. If you're eating a meal, and in this meal you've calculated, hey, this has got 50 grams of protein, I want this to have less than 500 calories, 500 calories or less. How does that work out through the day? If you do that 3 times, you have 150 grams of protein intake for 1,500 calories. For most everybody, that's going to be fine. You're going to end up with, positive health benefits by eating within that ratio.
And so is it better to do this through small meals or 3 meals a day?
So that depends. It can be done either way. This can be what's a tool for consistency, right? So when we look at the 3 pillars, protein, total calories, tools for consistency, the style of eating that you're doing would fall into a tool for consistency. This is things like time-restricted eating for some people, right? For some people, shrinking the eating window is a way to consistently limit total calorie intake. We're just eating over a smaller amount of time. You still got to make sure you hit your protein goal in that. Is there any benefit to having multiple small meals throughout the day? Not from a metabolic standpoint, right? There is actually a little tiny pitfall here in that if you're an adult, you really want to have a minimum protein intake when you eat of about 30 grams of protein. That's enough to hit what's called the leucine threshold and stimulate muscle protein synthesis. So eating a ton of small meals where you never actually go over that 30 grams, that could blunt your health effects a little bit. So I'd rather people have less meals. There is no metabolic magic to eating 5 or 6 meals a day. I know that was an idea from a long time ago that was probably popular in gym culture, but there's no scientific evidence to support that. You could get by with 1 meal a day. Again, that's a style of eating, but you've got to hit your protein goal when you do that.
So going to the gym, eating a little bit before, is there any detriment to that? Eating a little bit of protein, a little bit of carbohydrate to kind of keep your energy going?
So that's again, an individual thing. If it helps you work out better, it's totally fine. But again, there's this idea that there was an anabolic window that you needed to get your protein in like an hour after you work out because this is the only time that it's really going to have the most benefit. That's also not really true. The anabolic window is much broader than that. And as long as you've had adequate protein intake in the 24 hours previously, you're going to be fine. So, but if for you having a little bit of carbohydrate or a little bit of protein, that helps you work out better, then great, then go for it.
I think the key takeaway here that you're saying is a big meal with a lot of protein 1 or 2 times a day will enact the leucine effect, will help trigger more metabolic synthesis, muscle synthesis.
Right, muscle protein
and
synthesis.
So, yeah, muscle protein synthesis. So that will be, beneficial, more beneficial than not.
If you're hitting your protein target, that's really the goal. There is, like I said, a small pitfall, and if you're trying to do that through multiple small meals where you never actually go over 30 grams. So this is more of a finer detail. But yeah, if you when you eat at least 30 grams of protein.
Do you find people say that that's difficult?
I think that once people start measuring food, measuring their protein intake, they're often surprised at how much they need to try in order to hit that goal and how far under that goal they've actually been eating.
So tell me a little bit more about that, because what you're getting into there is tracking food. Can you break down what that actually means?
So I think that a great skill for people to develop is being able to look at a plate of food and understand how much protein and how much protein is in this, maybe how many calories are in this. I think that everyone should, at least for a little while, make use of a digital kitchen scale and start weighing out some portions, just to understand what a portion size is. Because we naturally don't have a good idea of that. Oh, there goes Frank.
Hi, Frank.
Yeah. I think it's good for everyone to use a kitchen scale, at least for a little while, in order to train your eye so that you can make a better judgment about what a portion size is, how much protein is in a particular portion of, chicken or fish or whatever it is that you're eating. And it really also helps you start to understand the different energy density in food. You can look at a giant mountain of green beans and realize that there's 100 calories in the entire thing. And it's like, oh my God, I can eat a ton of food when I eat like this. So I think that everyone should use a kitchen scale, at least for a little while. For some people, tracking macros and tracking calories or doing this through the use of an app, that's a great tool for consistency for some people. It's definitely not for everyone, though.
I know that doing it for a short period of time is super beneficial. It's just learning. You do it for 2-3 weeks, and then you kind of can remember, oh, that's what this is. That's how much that is. And then also in the apps, and there's several I'm sure that do this, is you can just scan the QR or the barcode of the product and then weigh it, and it'll immediately tell you how many calories you're eating right then and there. So,
right. And so, and the apps are getting pretty fancy. You can scan barcodes in food. You can build your own recipes in these apps. Some of them even have an AI thing where you take a picture of a plate of food and it's going to guesstimate what's in there. It's better than nothing, but at least it does give you an idea. The apps that I like to use would be like Macro Factor, Carbon, Chronometer. Those are all good macro tracking apps. I personally think Macro Factor is probably one of the best ones in the way that how it measures or estimates your energy expenditure. I think that's a great model. It's easy for patients to follow. It's easy for people to use.
Let's go over a little bit more of intermittent fasting, and that is in terms of, does it help metabolism in any way, or?
Right. So it's a great question. And there are a lot of things that get popular and they get some idea that these are magic ways of manipulating nutrition, right? It can be time restricted eating. It can be a specific diet like paleo or carnivore, right? If I do this, well, then I don't have to do anything else. And it really it's really not true. When we look at nutritional studies, what actually affects people, what are the factors that contribute to the metabolic and health outcomes we want from a nutrition standpoint. When you control for calories and you control for total protein intake, there is nothing magical in something like time restricted eating, or also known as intermittent fasting. So, but if for you, the individual, that's a style of eating that allows you to be consistent, then great, then that's a tool you can use. But yeah, there's nothing magic about it. A whole food diet, right? Oh, well, just eat a whole food diet. Well, yeah, why does eating a whole food diet give us some of these outcomes? Whole food diet is typically nutrient dense and calorie, it's low in calories, right? Low in caloric density or low in energy density. This helps you meet goal 1 and goal 2. And if you just love eating a whole food diet, that's a tool for consistency for you. But again, it's not magic that does this. Same thing for like being a vegetarian, right? But just be vegetarian. Well, being vegetarian is actually great if that works for you as a tool for consistency. If you're someone who hates vegetables and I tell you should be a vegetarian, that's not going to work for you. And it's also, I will say, a challenge for vegetarians or vegans to hit their protein target. Again, they need to be extra intentional about making sure they're getting adequate protein intake.
I've gone down that path and tried that, and it's not an easy thing. I end up just eating a lot of cookies, vegan cookies.
Yeah.
But
Yeah. And just because they're vegan, right? Well, they're vegan cookies, so they should be fine for you. It
Right.
seems to somehow that seems to not work out the way you think.
yeah, I eat a lot
Yeah.
of cookies though, and
Yeah. Well, like in time restricted eating, right? If you shrink your eating window to 6 hours, but in that 6 hours you eat 3,000 calories worth of pizza and your daily energy expenditure is 2,000 calories, this is not going to have the health outcome that you're aiming for.
right. So that's where it circles back to eating quality protein and
Right.
quality vegetables.
It comes back to being intentional and keeping our eye just on 3 things. What is my protein intake for the day? How is my calorie intake going for the week? And what am I doing to consistently do number 1 and number 2? That's it. When we look at it that way, it simplifies nutrition to a way that is really approachable to all my patients. I think everyone has a lot more success with it. They have a lot more buy-in too once they understand that this is something that they can wrap their head around, and they see that they can affect the changes that they want.
Right. You've said calories. You said this a couple times. Tracking calories for the week. Why are you that's different than tracking calories per day?
Right, because the total energy really is on a broader scale, right? Our protein goal is a daily protein goal. We want you to have this every day. But if you're a little over on your calories today and a little under on your calories tomorrow, that's totally fine, and it all works out in the wash.
All right. Hey, one thing that, goes with weight loss, metabolism, stuff like that is something that's happening right now is GLP-1s. How do they mix into this concept of nutrition?
Right. And GLP-1 medications are a great topic, and that's something I think that actually warrants an entire episode. So let's definitely put that on our schedule. We'll do a whole talk about GLP-1 medications. GLP-1 medications are an incredible tool for consistency. They definitely help you restrict your total calorie intake. When you use a GLP-1 medication, the benefits just from this point of view are a lot of patients experience a decrease in food noise, right? Less mental chatter about food. That's very helpful for some people. There's a decrease in just appetite overall. When you eat, you feel full sooner and you stay full longer. So the net of all of that is to decrease total calorie intake. Now, there is a pitfall with GLP-1 medications, right? Your protein target hasn't changed. And I've heard anecdotes from patients who are like, oh, I started this GLP-1 and it turns out it's 2 p.m. and I haven't eaten yet. Well, you still have your protein target, right? So you've got to make sure that you are being intentional, that you are eating, and then when you're eating, you're getting your protein intake.
The big questions people have, now I have to take them forever. How is that going to affect me? I mean, we'll cover this all later, but
Right.
just trying to get the surface questions that come to my mind.
Sure. And do you need to take a GLP-1 forever? Well, it's a great question. And again, let's talk about this in a full episode about GLP-1s. And what I say to that is, if along the way of using a GLP-1 medication to maybe lose some weight, you've learned a lot of new tools, right? You've developed a structured nutrition program, then no, you very well may not need to stay on this medication long term.
Right. So what you're saying is, if I have a weight problem and I say, I've tried a million things and here's this solution that's available today, GLP-1, if I take it and along the way, then I adopt a structured nutrition program, I consistently get enough protein and I build my muscle mass. I kind of change my own body composition through this process. The GLP-1 is helping me. Now I can then, start either reducing or eliminating the GLP-1 and focus on the structured nutrition to keep the metabolism going. Is that
right?
Am I getting that right?
Right. And you very well may not need to stay on it long term. Some patients do end up staying on GLP-1s for a long term, and there's lots of reasons we can talk about why that may be beneficial. But yeah, if you develop a new style, a new relationship to food, you develop a new exercise habits along the way, then you very well may not need to stay on these medications long term.
Right on. We've just talked about GLP-1s, Bob, and we've broken down a whole bunch of stuff about protein goals, calories, intermittent fasting, whole foods. It's just been really informative, and I think it's a good place to leave it right there.
I hope that's been helpful and at least a little bit entertaining. If you enjoyed the show, please like, subscribe, hype, and share the videos. We're a new channel and we'd like to grow. If you have topics that you'd like me to cover or you have questions about things that we talk about, please leave those in the comments. I promise you we will read every one of them and it will influence future episodes. If these are the types of conversations you'd like to have with your provider and you live in the state of North Carolina, please come check us out at SpartanMedicalAssociates.com. Until next time, be well.
Health Notes with Dr. Bob is produced in collaboration with Spartan Medical Associates. We see patients in person at our Charlotte offices as well as virtually throughout North Carolina. Learn more at SpartanMedicalAssociates.com. Got a question, topic idea, or feedback? Drop it in the comments or visit us at healthnotes.net. This podcast is purely for educational and entertainment purposes. Listening to our show does not create a doctor-patient relationship. While I am a doctor and we may speak with other medical providers, we are not your doctor. The content you hear does not constitute professional medical advice, diagnosis, or treatment. Always consult your own healthcare provider regarding your personal health matters.